Could you describe how we do palliative care?
Yeah. One thing that's really interesting about palliative care is a lot of people are like, what does that mean exactly? And that's a very fair question because sometimes I think I always wonder too, like, what exactly does that mean? Um, Palliative care, you'll find it in three different spaces in the healthcare system. You'll sometimes find palliative care in the hospital, in an inpatient setting. You may find palliative care in the outpatient setting in a clinic. A lot of times you'll see with oncology centers or maybe cardiovascular centers, they may have a palliative care specialist that could see you in appointments in the office. And then we have what we are doing here at Eden, which is bringing connected care home, right? And we are going out into our community for either home health or for hospice, and then also for palliative care and home care. And so our version of what we do with palliative care, how we do palliative care, is we come to you in where you live, because a lot of times when you are needing palliative care, it's getting harder to get to those appointments in the clinic. And most of our patients don't really want to be in the hospital. I don't know which patients really always say, yay, I'm going to the hospital. So, we bring that care to you in your home. We visit about once a month, which is more than most specialists see you. Most of the time you don't see your cardiologist once a month or your neurologist once a month, but with palliative care we can come see you on about a once a month basis where we just kind of check in and we see how things are going. We address four main principles when we are out in your home. We assess for what your goals may be. If you have specific goals about do you want to keep going to the hospital? If your heart were to stop, would you want someone to restart your heart for you? If you had to have a machine breathing for you, is that something you would want? Artificial feeding, is that a tube feed? Was that something you would want to have continuing? We talk about if you can't make decisions for yourself, who would you want to make those with you or for you? And we help make sure that your goals and wishes are written down on paper so that should there ever be questions, you have that all documented and you have things in place so that you can execute those goals and plans when and if those events happen. Another thing we focus on in palliative care is symptom management. So we don't manage every symptom that everyone has, but we focus specifically on that life-limiting disease and what symptoms are really burdening you for that life-limiting disease. So major symptoms that we help support are depression, anxiety, fatigue, insomnia, constipation, pain, breathing. So those are just a few that we really help with, because a lot of times when those symptoms are better managed, the quality of life day to day is just improved. Thirdly, one of our big goals that we work on is with families is we help look at what other resources they might need, what other advocacy they might need. We call this coordination of care. It might be anything from helping you get connected to like Meals on Wheels, or maybe you need help with a Medicare or Medicaid application, or maybe you have been really trying to get in with a specialist, so we might be able to help call and coordinate with your primary care provider and help advocate for you to get access to that specialist that you've been thinking might be helpful. So coordination of care, we do a lot of different pieces of that, and that can look a lot of different ways for patients and families. And then lastly, one of the big things in how we do palliative care in your home is we would help those conversations and give that professional and expert consultation as a specialty service on when it might be important for you to start considering a higher level of care. So sometimes the higher level of care, if your goal is, I want to keep going to the hospital, it would be us kind of saying, okay, yep, things aren't looking good, it's time to go to the hospital. Or if your goals are more of, oh, I'm tired of going to the hospital, this isn't what I want anymore, I've been in and out 3 or 4 times in the last 6 months, like I just want to be home and I want someone to help me here. We would be having conversations on if you qualify for hospice care. So our palliative care program, that's kind of our visit frequency. Those are some of the main goals of the interventions and plans of care that we can help you sort through together when we're out in those visits, is some of those primary principles.